and 65 students got placed only in Bangalore in the month of February. So they're again coming back on Monday. Okay. So this is what the precision medicine is. Okay. How many of you heard about telemedicine and remote monitoring? Anybody's aware?
It is basically the teleconsultation through which the prescription that is given is monitored, that if the patient is following the prescription or not, having the proper awareness of it or not, and if the vitals are getting active or not, or any symptomatic problem is there or not. That is what remote monitoring and telemedicine is all about.
Correct. That is currently. See, now we are in an age where we take consultation through Practo. Okay. Not all the patients are hospitalized. They're also taking their treatment at the comfort of their home, and their vitals, everything is monitored remotely. Okay. So this is there already. Okay. But in future, there could be, for example, there is a brain surgeon sitting in US. He wants to conduct a surgery. He have to come all the way from US for India. He have to perform. There will be lakhs of amount involved in it. But he's able to give the service only to one or two people, right? But there will be a day where he will be sitting there, he will be assisting some other surgeon here, and he will be performing this surgery on his behalf and taking his assistance. Doing this, he will be enabled, to give his service for many other people. Many people will be able to get his service, and his wisdom is also shared to others. But if this has to happen, we need technology according to that, right? It cannot happen through a Zoom call like this or a Google Meet like this. You need proper technology, right? You need proper devices and equipments to put this into practice practically. So that is also going to happen. Those kind of research is also happening in clinical research. And 3 weeks back, there was a robot conducted brain surgery in US. A very complex surgery like brain surgery, if a robot is involved. Okay, there are 10 others robotic related surgery clinical trials that are happening. Don't you think this is fascinating? From robots performing home chores, entertainment in restaurant, now it has come to healthcare where it can perform surgeries like brain surgery, which is very complex, not easy at all. Don't you think this can become new normal in 5 to 10 years?
Yes, it can.
Right? And you will be one of the few people who will be working in these kind of projects. And this would happen eventually, 5 years, 10 years, 15 years. Because see, laparoscopy, people were skeptical whether to use it or not. Okay. Laparoscopy was in clinical research for 6 years. And now people are using it around, say. C-section 30 years back, people were not ready. Now everybody are prepared for C-section. Same thing with appendicitis, right? So any surgery, for example, right, or any kind of a treatment, initially people will not be ready, and after practicing it and trialing it and proving it, once it comes out, initially people will be little scared, and once it shows results, it will become normal. But the crucial time is the clinical research. It would take years to practice this. Now you won't believe these robotic surgeries are in clinical research phase, and you will be one of the few fortunate people who will be experiencing and will be getting a lot of success in this. How many of you really feel it is interesting to work in such kind of top notch project?
I do feel that.
How
It's
about
very
others? Only Jayati feels it good. How about Dikshant, Harilal, Kavita, Shubhangi?
Yes, ma'am. I feel good.
It's good. Dikshant, what is your thought on this?
It's better and easier.
Okay. So now I think most of you have this confusion. People, I think almost 90% people have this confusion. Ma'am, I have applied for clinical research. Now, after you telling, I got a clarity what is clinical research, where will I work, what kind of a project. But am I a good fit for clinical research? Is clinical research a good option for me? Anybody have this question? Anybody ever thought this question? How many ever thought? Can you please raise your hand? How many have this question?
Can you please repeat the again?
So, how many of you have this question whether clinical research is a good career option for me? Because I've academically not studied clinical research. I've studied pharmacy, I've studied microbiology, biotechnology.
I'm so excited to hear how it will be better for my career.
Okay, first and foremost, okay, anybody can apply for clinical research. I'm talking about the criteria who are good for clinical research. Okay, when it comes to the company's perspective, who are the best fit is the PharmD graduates because PharmD are the only graduates who study clinical research in their fifth year, but they don't practice it in their sixth year. They work as a clinical pharmacist. That is the challenge. So the first preference is given for PharmD graduates and anybody, any master candidate or a bachelor candidates from pharmaceutical industry, microbiology, molecular biology, biotechnology, research field, pharmaceutical background can apply for this job. Companies are looking for people like that. Companies are not entertaining the normal graduation like zoology, botany, not that. Okay. But if in case if you're having some kind of a knowledge in the research like or pharmaceutical or lab microbiology or genetics, these kind of a research related knowledge or pharmaceutical related knowledge, company will definitely welcome you. So most of you who have joined here today are from that background, pharmaceutical background, microbiology background, right, biotechnology background. So you don't have a second thought. This is one of the best career option for you. Okay, even companies are looking for doctors. Okay, they are looking for people like MBBS, BDS, Ayurvedic doctor also because they're as in par with PharmD graduates. The first preference will be PharmD, definitely. Okay, and then comes MBBS, BDS, Ayurvedic doctor, and then master candidates from any research related knowledge, chemistry, biochemistry, molecular biology, biotechnology. Okay, these kind of industry are also welcome. Got it? Now you have a clarity of thought. Kavita, Shubhangi. Maybe Dr. Shubhangi have this doubt whether it is good for me because I've studied 6 years. I'm into
Yes.
clinical practice, whether I can go for this, right? You can definitely go ahead, not a problem. Okay.
Okay.
How many of you really feel there's a requirement of training for clinical research? All of you are aware there is a clinical research training related content only we're going to talk. And still you showed up, right? It's been 9 o'clock, but still you're in the session. That itself shows you people are aware about clinical research. You want to make your career. I appreciate that. But how many people truly feel there is a requirement of training? And if you feel yes, why? Why do you feel there's a requirement of training?
Training is required all throughout because if I need to upskill myself, training is the
Understand people in this set. Somebody like Jayati, who's already worked in research department, her herself feels there is a training required because practically without training you cannot shine in this career. Forget shining, you cannot even get an entry to clinical research. I'll tell you why. Any industry, whether it's accounts, finance, IT, companies are looking for people who are skillful, who already have some industry knowledge. A finance professional learn financial analyst related skill, financial modeling, Power BI, analytics, right? An IT professional learns analyticals and they'll learn the softwares, right? They learn the programming language. Likewise, when it comes to clinical research, also you should learn because you don't have an option. We don't study clinical research. Academically, we have zero knowledge. We're not exposed to this area at all. It's a research field. Many things are kept away from the humans interference, right? You have zero knowledge when it comes to clinical research. So even if you get a job, you cannot sustain in this industry. First of all, companies are not ready to hire with no prior knowledge. That's why for a fresher, they ask two things, either a training program or an internship. Again, internship is not easy to get. Okay. So training program is mandatory because you cannot do justice to work because this is a noble industry, very sensitive area, and there is no room for error here. First of all, you are testing it on healthy volunteers and thousands of people. If something goes wrong, it can actually cause very uh, I know wrong things. Okay, either it could be a side effect, even death of the person, and if the product comes out to the market, and if it's not a proper quality product, if the trialing testing is not done properly, it can affect the masses. It has happened in Johnson and Johnson case. The Johnson and Johnson talcum powder, right, due to the carcinogenic effect, it was not found during the clinical trials. Okay, and because of which every 10,000 baby who uses it, 20 babies will get skin cancer. It is proven and it got banned, and now Johnson and Johnson is in the problem. It lost their market. It was a market leader for almost 30 years. We all have used Johnson and Johnson product. It was the only market player, market